5 top fears, concerns my patients have about Botox and fillers, and I'm gonna clear them all up for you. When we treat the jowls, you can end up with your lip crooked. I've injected and dissolved filler that was 10 years old. I don't want to look weird. Will I look fake? And it's a reasonable concern because we all have that one woman in our town, in our neighborhood. Her lips are like this, her cheeks are like this, and she looks obviously done. Procedures did not respect the anatomy of the patient, but I promise you there are so many people that are done so well and they just look good and your eye does not register them as being done. They just look well rested, lifted, natural. To look fake or weird with filler, it happens because typically too much product is used too fast, and again, not respecting anatomy of the patient. Especially in the beginning when fillers were just kind of new, a lot of trainers, a lot of injectors were saying you should see patients every 6 to 9 months. Fillers last up to a year. I personally have been in the medical anesthetic dermatology for 18 years at this point. I've seen through all my years of practice that filler lasts a long time. If a patient really goes in every 6-9 months, every year, and fills the same spot over and over again, yes, they will have too much accumulation of that filler because they fill faster than their face changes due to either aging or weight loss. Of course, some people have unrealistic expectations and they want to fill in order to lift. Filler doesn't really lift. It's definitely more of a contouring, more of a volumizer type of product. Even today I had a woman whose real concern that I saw were the laugh lines or nasolabial folds. But she thought if we inject her cheeks, it will lift and eliminate that shadow in her nasolabial folds. And that's really a concern if she would have gone somewhere else and they really filled her cheeks, because then she would walk around with a chipmunk cheek and still the nasolabial fold being present. There is definitely a variable that can influence a patient looking unnatural or fake or weird. One variable is the injector, the skill of the injector, the vision of the injector, the understanding of the anatomy, and respecting patient's natural anatomy. And the second variable is the patient who is looking for unreasonable results. Unfortunately, a lot of patients will find an injector that will keep filling, and they never hear no. With Botox, what I see, the unnatural look is typically created where there is no kind of harmonious treatment plan and people just concentrate on eliminating lines and wrinkles in 1 or 2 areas. You have to understand that all our muscles, they kind of pull and push and tug, and there are opposing forces. There's always a compensation mechanism. So if you relax one area, the other area will compensate. So many people come in and they just want their upper face treated. And it can be okay for somebody who's in their late 20s, late 30s. That will be enough. But I have women who are in their late 30s, 40s, 50s, and they look to do just their forehead, between the brows or crow's feet, or just between the brows, and that's all they want to do. But the whole face has aged. They already have, jowling. They have a little bit drooping down of the corners of the mouth. They're losing the contour in the jawline. So when they just treat that upper face, but there is a mismatch in the lower face, I will catch and recognize something is off. I have patients who have skin barrier that's not intact, meaning the skin is dry, it's irritated. They continue to tan on already having sun damaged skin and they get Botox. Again, there is less of a harmony in the whole appearance. They don't have wrinkles, but their skin is sun damaged enough where they should. So again, somebody who is looking at that patient, their brain subconsciously even will recognize there is a mismatch. So it's very important to not only just do Botox, but take care of the skin, because skin is aging. It's aging faster when there is sun damage and you continue to tan. Any tan is sun damage, and the effect is cumulative. So the tanning you do now, you will see the effect of it 20 years down the line. The skin is creasing. So you want to make sure you take care of the skin, because whatever I do with injectables here will give you, 80% of improvement. But what you do with your skincare at home, whether it's, vitamin C, retinol, sun protection, moisturizing, exfoliating, that will improve the overall appearance and minimize that done look. So when I have you in my chair and I give you a recommendation about skin, it's not about me selling a product. I want you to have the best result possible, because at the end of the day, your face is my business card. The safety of injections. Both filler and Botox have a very well-established safety profile. So Botox was first approved for medical concerns in 1980. For cosmetic reasons, it was approved in 2002. So that's many years of this medication, which Botox is. It's a prescription medication. It's been studied not just for aesthetic purposes, but for medical reasons. So we have a lot of studies, a lot of data about safety, and on medical side, Botox is used in much higher dosages. We have the information, we have the data, we can share it with our patients. Of course, like any medication, it's not, free of side effects. Just like if you buy aspirin or Advil, if you read the insert, it's a long list of things that can potentially happen. The most common things are, of course, injection reaction, meaning you have little bumps, maybe a little tenderness, maybe a little bruising, possible headaches. Less common, but those are the ones that we hear about on social media because they are so dramatic, are eyelid ptosis, brow ptosis. You can get kind of change in the smile when the masseter is treated, which is your kind of chewing muscle, and when that's treated, sometimes one side will keep pulling and the other one won't. When we treat the jowls, you can end up with your lip crooked. But the good thing about Botox, all these side effects, they're temporary. They can be mitigated to an extent. Eyelid ptosis can be improved with eye drops or injecting the eyelid in a different area to open it up. We can also do saline flush injections in certain areas to kind of flush out Botox or any other neurotoxin. And it's temporary. Typically, if you don't do anything, within a few weeks, everything goes away and you return to normal. With fillers, so we have hyaluronic acid fillers. That's what most commonly is used. And we also have a filler like Radius, which is calcium-based. So calcium-based filler like Radius cannot be dissolved. It's injected most often for creating support and contour, so deep on the bone. It mimics bone. And in hyperdilute form, it's injected more superficially because it causes your body to create collagen. The side effect profile, of course, tenderness, bumps, lumps, those are temporary in most cases, bruising as well. Potential side effects that are a little more concerning and are more difficult to get rid of are nodules. And nodules can be inflammatory and non-inflammatory. Sometimes there is infection. Sometimes it's your own body attacking the filler for whatever reason. Maybe you have autoimmune disorder. Maybe you had COVID. With Radius, typically we can not dissolve, but we can break it down. I personally don't use it for most of my patients, only for particular cases. So hyaluronic acid filler, it's clear gel made of hyaluronic acid, which is a sugar molecule. Again, when we inject it, we expect maybe injection site tenderness, maybe bruising, temporary redness. The worst possible thing that can happen with filler, whether it's hyaluronic acid or Radius, is vascular occlusion. That is when the product is inadvertently injected into the blood vessel, occluding the blood flow in that vessel. Most of the time, it can be observed right away. I do check for blood flow after all my injections. I have an ultrasound that I utilize as well to check that the blood flow is intact after the injections. But if it does happen, hyaluronic acid can be dissolved, can restore the blood flow. If it's missed and it's found that the occlusion happened days later, it can be more involved with other medication, possibly steroids, possible antibiotics, but it's extremely rare. Of course, the occlusion in certain areas are more concerning. There are arteries near the eye, and if the blood flow is not restored, there are cases of blindness that have happened. So vascular occlusion is serious. I'm happy that I have an ultrasound, that I can map out the blood vessels before filler and check the blood flow with ultrasound after. But in general, these medications have been on the market for a long time, so they're very well studied. There is a lot of fear mongering about migration, and it usually happens when too much product is placed too fast into incorrect lanes. Sometimes it's incorrect filler that has been placed. Typically we see migration with lip filler and under eyes. Sometimes I see migration with the cheek. That's less common, and I'm starting to see some migration with chins because that's been a very trendy injection to do, and everybody gets these sharp pointed chins. They are getting overfilled and almost like getting very flexible soft chin. Again, the most important thing is to respect anatomy, have realistic expectations. Lip filler, I typically don't refill sooner than a year and a half, and in some cases 2 years, because filler lasts, and if you keep injecting, there is limited space. That filler, if there is too much of it, will move just because it needs to move. Otherwise, there is no space for it to exist where it was injected. And if it migrates either above the red of the lip or into the mucosa, it does not dissolve. Typically, it lasts longer than the filler in the lip itself. I've injected and dissolved filler that was 10 years old and 15 years old. Under eye is a very delicate area, and a lot of people want to eliminate any shadow, any bag. That's great. I want that for everybody, but the filler will not do it to the extent that most patients want to. With filler under eyes, we need to undercorrect and expect that over time filler will pull a little bit of water, because that's what hyaluronic acid does, and we need to leave a little bit of space for that water to exist until filler dissolves, gets absorbed, broken down by your body. With chins and cheeks, most of the time it happens because too much filler was placed too fast. I recently had a girl with 3 syringes of filler in her cheeks that were hyaluronic acid based, and a syringe of Radius, all within I think a year or 2 years. And she was a petite girl with a petite face. So that much filler, it moved, but we were able to dissolve it. It only happens if you get greedy with the results, if you have unrealistic expectations. And my advice is find an injector that matches your aesthetics. If you want more of a glamorous contoured look, you probably end up getting that result with the injector who has that same appearance and aesthetics. If you want more of a conservative appearance, natural, undetectable filler, then find an injector that has that aesthetics and that look. Do injections hurt? Nobody wants to be in pain when they get their Botox or filler. If the injection is done by a heavy hand, patients are not numbed, they're not informed, they're anxious, yes, it will be unpleasant. There are things that I do to make the injections as pain-free as possible. Of course, there is numbing. There's topical numbing. There is local anesthesia. For lips, I want my patients to be numb and comfortable and relaxed, so I do a dental block. It takes effect very fast. It lasts about 20 minutes. Patients don't feel any pain at all. In some areas, I might use a topical anesthetic. It's not as effective for injections as people imagine. You still feel a little pinch and mostly pressure, but it gives kind of a calming effect that a topical numbing is used for some people and they relax. For my Botox injections, most of my patients report that they're really most pain-free. I do a little trick with skin manipulation when I inject, and it really distracts the patients and minimizes any sting of the injection. I don't conform to the notion that beauty is pain. I like to make my patients as comfortable as possible, and I talk patients through the procedure so they know what to expect and they don't get startled when I just touch them or I clean their skin. What if you don't like the results of your injections? Well, if it's Botox, you're stuck with it for 3 to 4 months unless it's something that can be corrected or touched up. For example, some patients, when they get their Botox injections, they have what's called a Spock brow. You don't have to walk around like this. You just need a little injection in the forehead muscle so that brow comes back to its natural position and you don't look weird. What if you get drop in your eyebrow, drop in your eyelid? We can improve it slightly until the effect of Botox wears off. What if you get kind of this lip does not drop down when you smile? I've treated it successfully several times where I've resolved that issue within, I would say, 2 weeks. So we can improve it, but it still will take usually a couple of weeks to, look normal. With fillers, if it's hyaluronic acid based, you don't like it, it can be dissolved. It's an injection of an enzyme called hyaluronidase. So this is a filler. The filler is a clear gel. I'm just going to squeeze a little bit here. And this is hyaluronidase. And I did very little, but it's basically melting the hyaluronic acid. And some fillers are harder to dissolve than others. And you see some immediate result usually. And then over the next 48 hours, it improves even more. So I'm adding a little more of hyaluronidase. And slowly the hyaluronic acid kind of just breaks down and becomes more and more liquid. So before it really held its shape, filler out of the syringe, it's sticky. And this is dissolved hyaluronic acid. So if you don't like it, it can be dissolved. Like I said, I have an ultrasound to really be more precise with my injections of hyaluronidase.